Greetings, Eric Bakker. Thanks for coming back. I'm going to talk about the gut health assessment today. We put 133 people through the gut health assessment, and I got some results here which are quite interesting to discuss. So on Candida.com, I created an assessment which has got 5 potential outcomes. We've had quite a few people do this assessment, but I grabbed just a batch of 133 people, and I put that through an AI model, to see exactly what the outcome is. So it's all private and confidential, but all the symptoms have been tagged on this assessment so I can determine exactly what's going on with people when they go through this assessment. It's the only assessment I know that's got 5 potential outcomes. So it's about 50 questions, takes you about 5 minutes, and it's going to come back whether you're either Candida dominant, which is fungal, or SIBO dominant, which is bacterial, or irritable bowel syndrome, which can be fungal, bacterial, nervous system involvement. There can be multiple reasons why you've got IBS. And the other one is called leaky gut or intestinal permeability, can come back as a dominant factor. And the final one is gut microbiome depletion. This is people who've been sick for quite a long time with multiple problems and food intolerances, and they may have allergies. They could have autoimmune problems. They've been on medications for years. These are quite sick and depleted, people that I've seen over the years. So how the heck did I create this assessment? Well, it took 6 months, and I based it on a hell of a lot of patient case-taking files, stool test results, food allergy reports, blood tests, symptom inputs for multiple people. I came to a conclusion there are 5 dominant types. There's a lot more than 5 types, but there are 5 dominant types of people that I've seen routinely in my clinic, and those are the outcomes. So you'll see my eyes moving around the screen a bit because I've got different reports I'm going to look at, but out of 133 people, we found that 85 out of those 133 were affected by antibiotics. So that was my background. My gut was destroyed by antibiotics when I was in my 20s. And I know a lot of other people out there will be nodding their head and saying, well, my gut's been destroyed too. And this is a common denominator with a lot of people with IBS or Candida. Their gut got shredded by a drug, and they never really fully rebuilt their gut jungle, since that point. I've seen this hundreds of, if not 1,000 times. So 85 out of 133. So that's 64% of people out of 133 came back and ticking the never been well since the antibiotics. So I've got my work cut out on YouTube, that's for sure. And I'm going to definitely be looking at antibiotic, induced gut carnage videos in the future. If we look at another one, it's stress-related issues. 74 out of 133 ticked, I've got a stress problem that's affecting me. And we're seeing that a lot today, probably even more so than when I was, in active practice. 55% reported food sensitivity. 54% reported brain fog. 52% reported bloating. And 51% reported constipation or, loose bowel function. The top 5 common issues I saw out of 133, stress-related, food sensitivity, brain fog, bloating, constipation, and diarrhea. Very, very common thread that I saw in my practice over all the years. So that was just a quick video to explain about the gut health assessment. If you haven't completed it yet, you can go to Candida.com and complete that assessment. It's free of charge. It will put you through about 50 questions. It takes about 4 minutes. And I'm compiling all of this information over the next several years, and I'll come out with a big report eventually with tens of thousands of people, and we're going to make some interesting pie charts to see what's going on there. And this allows me to base future educational resources and even specialized products based on exactly what I'm seeing, what the inputs are. So the inputs will also create specialized outputs, of course, which will allow me to fine-tune what I'm doing here on YouTube. Not interested in retiring. I could have long retired, but I just enjoy this kind of work, the analysis and the helping people out. So give us your feedback. And if you haven't done the assessment yet, Candida.com. Thanks for tuning in.